Dear colleagues, I'm very pleased to greet you on behalf of Niigata University research team. My name is elderl, and I'm going to present a topic, application of high-pressure technology for the development of texture-modified food for the elderly and people with dysphagia. Aging population is increasing rapidly. In 2019, 22% of the total population in the Russian Federation and more than 28% of the total population in Japan were over 60 years old. The issue of aging population brings some serious problems. One of them is that number of people with specific nutritional needs for preventive care, and all kinds of health care, help, and nursing increase. One of the most increasing disease is dysphagia, which means problems with chewing and safety swallowing. Market in society demand for healthy foods for the elderly or populations with specific needs greatly exceeds available supply. That is why providing these soft, tasty, texture-modified foods for the elderly or specific populations became an urgent task for both academia and food industry. Objectives of this study are: first, outline the situation with foods with the elderly population and people suffering from dysphagia, both in Russia and Japan. Next, we will outline Japanese initiatives in the area of food for specific nutritional and physiological needs. It is called Smile Care Food. And the main target of our present study is description recent technological achievements in the area of texture-modified food, with the special attention to the high-pressure processing technology. In Japan, there is a statistics that up to 70%, from 50 to 70% of the people aged 65 and over have some kind of problems with undernutrition, chewing, or swallowing. That is why, in collaboration with academic and practitioners from food industry, the Japanese government created a special regulation system which is called Smile Care Food. This system divided all functional foods for the elderly and people with special nutritional needs into three categories, two of which, with yellow and red label, are specially tailored for nutrition for people with dysphagia problems. Unfortunately, the great and ever-expanding demand of the Japanese market was not satisfied, but due to the new regulation system, market of dysphagia-friendly foods doubled since 2010, and it is projected to amount to $252 million American by 2025. While creating foods with special purposes for elderly and dysphagia population, we need to take into account many different aspects. In the center of our research are problems with mastication and swallowing. That is why products created for this group are intended to be soft. Particles should be small, not bigger than 1.5 millimeters. The bolus should be moist, cohesive, slippery. That is why it becomes easy to swallow. Actually, texture-modified food is a term that refers to the food with soft texture and reduced particle sizes. Food texture for the elderly should be soft, moist, and sometimes it includes liquids. Liquids are thickened to various extent according to the purpose. Texture modification can be achieved through chemical or physical processing, mincing, making puree, or liquidizing food. Technologically, texture softening effect may be achieved by several known technologies, and one of them is high pressure processing. That is why high pressure will become the center for our next slide. High pressure processing is non-thermal technology by which a product is treated or at above or more than 100 megapascals by means of compressed fluid. This technique first was applied in Japan in the late 1980s. Majority of food product facilities treating with high pressure are used for products made of vegetables and fruits. However, in recent decades, application of high pressure for development of texture modified health food in meat, in fish products in Japan is becoming very popular. As we can see from the table, recent studies succeeded in pressurized muscle products, pork meat, fish meat, and beef meat. Gels achieved at the results of these studies met all the necessary requirements from the Japanese standards for dysphagia-friendly food. Traditionally, sodium chloride, sodium phosphate, and fat are very important, play a very important role in affecting functional characteristics of meat products, including taste and flavor. But at the same time, it is known that high intake of salt, phosphate, and fat have potential risks on health. That is why creating tasty but healthy meat products with low salt, low phosphate, and low fat becomes a big challenge for the whole meat industry. As we can see, that treating meat and fish gels with high pressure let it possible that myofibrillary protein conformations occurred, which led to protein denaturation, solubilization, aggregation, or gelation, and thereby happened that textural properties modified, which were enhancing water binding and the stability of meat gels. An appropriate choice of high pressure parameters and components for lower doses of salt, food additives, and fat content allowed to create new functional products which can be used for the dysphagia diet. In the conclusion, I would like to underline that providing a fast-growing segment of the elderly with tasty and nutritious foods is a big challenge for many countries around the world. In Japan, the history of tackling of this problem is longer than 30 years, and research and work in the food industry has quite big experience. For example, Smile Care Food is a special system for labeling, which created a good base for many commercial products creation. Russian market of functional foods targeted for the elderly population is still underdeveloped. That is why we suggest that practitioners and specialists in academia would pay attention to the technology of high pressure processing, so that to create texture modified food oriented especially for the elderly people. All wide possibilities of this technology is outlined in this table. It will create possibilities to develop new health products with absolutely novel textures, foods for the elderly and population with specific health needs, including dysphagia. Also, it may help to create products with reduced contents of food additives and to help create foods with clear labels. Thank you for your attention.